do greetings. My name is Terry Fullen, and I'm a licensed professional counselor working at Lenape Valley Foundation in their outpatient department. I would like to thank everybody for the invitation to speak at today's Lunch and Learn. The topic today, as shown on the slide, is anxiety, depression, and self-care during COVID-19. This is a topic I could probably talk on about for weeks, but since we've only got lunch, I'll talk fast. All right, discussion topics. I've broken the topics down into an introduction, anxiety, its signs and symptoms, depression, its signs and symptoms, how they go together, and then self-care. As well as in here, I've added, when do you seek help? How can you tell you need to, get more help than the self-care you're giving yourself? Things like that. So I'm going to start today with something experiential, head and neck exercises. I'm going to preface this with, if you're injured or you don't want to do it, this is completely voluntary. The last thing we need is people going to the emergency room or calling the doctor because they hurt themselves in a self-care webinar. That's not what we're looking for. But we tend to carry a lot of our tension and stress and anxiety in our neck and our shoulders. And I don't, whether you sit in front of a monitor all day since COVID started, or however your daily activities, wherever they take you, we're walking around with a lot of us are walking around with a lot of stress and tension. So I'm not going to do the full repetitions. I'm going to just give you an idea of what they look like and give you further information if you care to. So the first one is called neck drop and raise. This is center, just my head's just facing this way. I'm going to slowly drop my head to my chin to my chest, and I'm going to count till 10. Just going to do it gently. I don't have to pull. I don't have to. With me, I don't do this enough as much as I should. So you might hear some creaking. Yeah, that happens. And that's okay too, because I know it, and I'm going gentle. So, all right. So on the count of 3, I'm going to gently start. 1, 2, 3. I'm going to put my head down to my chest and count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly bring it back to center. I'm going to take the back of my head and lean it back towards my upper back and count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. And you can hear the stretch in my voice. The next is a head tilt. We're going to slowly tilt your head towards your right or your left shoulder, whichever one. It's not a, and we're going to hold it for 10 and then return to center and then go the other way. So I'm going to start with my right side. I'm slowly take my hand and just tilt it towards my right shoulder and count to 10, 2, 3, 4, 5, 6, 7, 8, 9, 10. Gently bring it to center. And then the other side. 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah, we got 2 more. This is called the neck rotation. I'm going to take my head and point it to the right as far as I can go without hurting myself, but I'm still feeling a stretch. So here I go. 1, 2, 3. Turn my head to the right. Feel the stretch. 2, 3, 4, 5, 6, 7, 8, 9, 10. Bring it back to center and to the left. 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. And one more is the shoulders. We're going to go up and forward and down. And we'll just do it 5 times up and 5 times back. Okay. On 3. 1, 2, 3, up, forward and down, up, forward and down, up, forward and down, up, forward and down. one more time. Up, forward, and down. And then towards the back. Up, back, and down. Up, gently, back, and down. Slowly, up, back, and down. Up, back, and down. Again, I can hear the creaks. One more time. Up, back, and down. There we go. I try to close my eyes because I tell myself it works better when my eyes are closed. So, okay, just to get it started. All right, introduction. It's okay not to be okay, however you want to put it. It's okay not to be okay. One of the most important things we need to do is normalize and validate everyone's feelings about what's going on, especially when it comes to living and working during a pandemic. Whether you refer to it as COVID or the virus or coronavirus or the vid, it's huge. Most of us were not around 100 years ago when the flu pandemic hit the world. That means that none of us have ever been through a pandemic. That includes therapists. You've never been in a pandemic. I've never been in a pandemic. I've never counseled people in a pandemic. Well, I can say that I have now, since it's been almost, in 2 weeks, it'll be 1 year since I was told to work from home because of the pandemic. So before the pandemic, we had folks with anxiety and depression, and the pandemic came along. Then we had a pandemic come along, and we have folks develop anxiety and depression. Still anxiety and depression, no matter how you look at it. So when I started thinking about how to counsel folks in a pandemic, I was upfront, said, hey, I've never done this before, but I thought I'd go to what we do know that works, which is starting with going back to basics. We stress basics anyway in therapy, and they seemed even more critical to focus on, especially at the start of the pandemic. And then I found when we would have surges, and even today, and I stress to folks, try to keep the day in the day. Especially back in the beginning, it was very easy for folks to stay up all night and play video games and sleep all day. So I started asking people, how are you sleeping? How's your appetite? Are you making out okay at work? If you take medications, are you taking them? And then exercise. Are you getting any exercise? Well, we can't go out as a pandemic. We can go out back. You throw a ball around, whatever it takes. I don't say it like that to clients, but that's what we can do. And I'm going to focus a lot today on what we can do, because what we can control is the most important thing. And then I started asking folks, like, what are you doing for enjoyment? And they're like, what? We're in a pandemic. And I'm like, yep. So we have any puzzles in the closet or deck of cards in the drawer? Sit down and play some games together. Even if it's video games, if it has to be video games, so be it. Just do something that you all enjoy together. All right, after the basics, before I get into anxiety and depression, I wanted to just talk about stress. Although stress and anxiety share many of the same emotional and physical symptoms like uneasiness, tension, headaches, high blood pressure, and loss of sleep, they have very different origins. Determining which one you're experiencing is critical to finding an effective treatment plan and feeling better. I have found in my work, people, whether they're in counseling or not, generally want two things. People want to be heard, and they want to feel better. Most people experience stress and anxiety at some point in their lives. Depending on the level of severity, they can detrimentally impact one's quality of life. Although stress and anxiety share many of the same emotional and physical symptoms, like we said, again, stress is a response to an external cause, like a tight deadline at work or having an argument with a friend. And then it subsides once that situation has been resolved. Right? Because stress is caused by external factors, tackling these head-on can help. So, there are many ways to manage stress, and a lot of them look like the ways to manage anxiety, and I have them. But just right off the bat, in physical activity, breathing exercises, adequate sleep, yep, I'm going there a lot, and taking time to connect with others. Anxiety, on the other hand, is a person's specific reaction to stress. Its origin is internal. It's typically characterized by a persistent feeling of apprehension or dread in situations that are not actually threatening. Unlike stress, anxiety persists even after a concern has passed. In more severe cases, anxiety can escalate into an anxiety disorder, which is the most common mental health issue in the United States. So again, if you're feeling some sort of way, any sort of way, I'm going to normalize and validate it, and you're not alone. This is the APA's definition of anxiety. The APA is the American Psychological Association. It's an emotion characterized by apprehension and somatic symptoms. That's the body keeping the score, basically, and doing all kinds of weird things of tension in which an individual anticipates impending danger, catastrophe, or misfortune. The body often mobilizes itself to meet the perceived threat. Again, muscles become tense, breathing is faster, the heart beats more rapidly. It might be distinguished from fear, both conceptually and physiologically, although that fear, stress, and anxiety are often used interchangeably. Again, anxiety is considered a future-oriented, long-acting response, broadly focused on a diffuse threat. Whereas fear is an appropriate, present-oriented, and short-lived response to a clearly identifiable and specific threat. Okay, that's the formal definition. Here's what it can look like in folks. Common symptoms. They include increased heart rate, again, brain zaps, I call them blips, shaking, trembling, twitching, nausea, stomach pains, burning skin, hot flashes, pressure in the chest or head, blurred vision or eye strain, ringing in the ears, weak legs, or restless legs. Do you need to have all of these for a diagnosis of anxiety? Nope. Is it possible you could have symptoms of anxiety that are not up here? Absolutely. There's different types of anxiety disorders, like social anxiety disorder, generalized anxiety disorder. That one is literally worrying about if you're worrying too much. And unspecified anxiety disorder. Is it always a disorder? Nope. More about that later, though. Depression, negative affective state ranging from unhappiness and discontent to an extreme feeling of sadness, pessimism, and despondency that interferes with daily life. Various physical, cognitive, and social changes also tend to co-occur, including altered eating or sleeping habits, like can't get out of bed, lack of energy or motivation, difficulty focusing or making decisions, and not attending social activities. Here's what you don't see in folks with depression. And I liken this to the commercial for the medication for depression, where the woman walks around with a paper plate of a happy face, and back here, that's not how she's feeling. So what you don't see, trouble sleeping. Depression is the hardest thing with depression to do is get out of bed. And the best thing for depression is to get out of bed. It's a tough one. Change in appetite. Fatigue. Fatigue is being tired of being tired. Less interest in sex, intimacy issues, lack of motivation, you can't get going, muscle aches, not enjoying things you used to. That's a biggie. Thoughts of self-harm or suicide. No, I might as well give up. Negative self-talk, headaches, feeling down or numb, upset stomach, feeling worthless, hopeless, angry, or irritable. Difficulty concentrating or remembering things. Again, one doesn't have to have all of these to be diagnosed with a depressive disorder. Depressive disorders can also be broken down into several categories, the majority of which fall under major depressive disorder. All right, I tell my folks, anxiety and depression are best friends forever, and they share symptoms that are alike. Take a look at the side with anxiety, take a look at the side with depression, take a look at the middle. Excessive worry, somatic complaints, that's the body symptoms. Difficulty with thinking, concentrating, or making decisions. Restlessness, agitated, appetite or sleep disturbances, and social withdrawal. The thing with anxiety is it always wants to be in the driver's seat, and depression wants to be in the passenger seat because they're best friends. That puts anybody struggling with anxiety and depression in the back seat or even the trunk. And that can leave folks feeling as if they have no control. I object. This is where I get into it with my clients. That is not the case. Anxiety wants control. Anxiety wants us to think we have no control. Anxiety wants us to think it can hurt us. And when we do that, we give it control because we don't want to be hurt. But in fact, anxiety cannot physically hurt us. It just can't. Now, when I start talking about how anxiety cannot physically hurt us, I've learned that this can actually cause people's anxiety to go up. Because I've had clients and I'd be like, what's going on? You know, and I realized me going up against their anxiety by educating them on it is they're becoming aware that, wait, what, I mean, I don't have to let it control me. It can hurt me. And that can cause an increase in their anxiety because again, anxiety wants control. Okay. Once folks realize anxiety can't physically hurt them, they can begin to learn and accept that maybe they have more control than they think they do. I can't control anyone else, but I can control myself. So what is it that we can and cannot control? My thoughts, my words, my choices, my actions, my reactions, my future. And in reactions, I like to sub out response because people tend to react and don't take a moment to think about how they could respond instead. So we have no control over how someone might speak or think or behave. And when we think we have no control over that, we tend to think we can't control that, so I can't control anything, and then I give up my control. In actuality, what we do have control over is what we do with what others do and say and think and how they behave. We have choices. We can walk away. We can say, I'm not going to engage with you over this. I'm going to take a break. We can control how we choose to act based on what's best for us and not how we think we should because we don't have any control. All right, I went back to the days here. You have power over your mind, not outside events. Realize this and you will find strength. Freedom and happiness are won by disregarding things that lie beyond our control. And I will say it's not easy to acknowledge I don't have any control over that. It's also, it's not brain surgery. It takes some practice. So we want to find our power. When I counsel people, I make sure to let them know that I do not tell people what to do. I believe we all have enough people telling us what to do. And if I tell people what to do, then I'm just one more person telling you what to do. I want people to find their power in making their own decisions. Of course, if the building's on fire, I will tell you to get out. But that's the only time I'll really tell you what to do. All right, now we get into control and corona. I can't control, so I can let go of these things. It takes some practice, but it can be done. If others follow the rules of social distancing, the actions of others, predicting what will happen, other people's motives, the amount of toilet paper at the store, that was more for in the beginning, but it's still, you never know, you want to make sure you have enough. How long this will last or how others react. I can control and focus down on my positive attitude, turning off the news. Oh, I've had people share with me they have 5 news channels on 24/7. Oh, that's not healthy. Yes, get the news, not 24/7. Finding fun things to do at home. There's your puzzle, deck of cards. Limiting my social media, how I follow CDC recommendations, my own social distancing, and my kindness and grace. These are the things that we have control over when the anxiety wants us to think we have no control over anything. Okay, when to seek help. At the beginning, I mentioned it's okay to not be okay. It's also okay to ask for help. The first step is knowing it is completely normal to experience a wide range of emotions. Acknowledging and accepting our feelings is super important as the first part of feeling better if we are struggling with anxiety and or depression. I believe it takes a lot of courage to reach out and say, I need some help. All right, so when to seek help? If your anxiety keeps you from sleeping, working, social interactions, or errands, you may want to reach out to a therapist. If you feel anxious for more than half the week for 6 months or longer, it's probably time to seek help. You don't have to wait that long. Just because you reach out and ask for help doesn't mean you're going to get a diagnosis. Right? Now, this can get a little bit tricky because the preferred behavior of anxiety is avoidance. Right? Anxiety, depression, best friends forever. Avoidance is what anxiety wants us to do. Okay? So we encourage folks to reach out and ask for help, and the anxiety focuses on avoiding any behavior that we feel might cause us anxiety, including reaching out for help. Point to remember is it cannot hurt us physically. Also, when we avoid behavior that we think might cause anxiety, yes, we feel better, but only in the moment. Then later we feel worse. We missed the appointment. We begged out on a social gathering. Perhaps we missed work. Depression. If your depressed mood lasts for more than 2 weeks or is seriously interfering with your ability to function at work, with your family, and in your social life, or is causing you to contemplate or plan to commit suicide, it would be a very good idea for you to consult with a mental health professional as soon as possible. Depression wants us to stay in bed. The more we stay in bed, the lower we get. Feelings of hopeless, worthlessness, I mentioned them earlier. This is stuff we don't mess around about. When I write goals for folks surrounding safety, it's always 100% of the time. They'll reach out or take care or figure something out. So up here, I've got some crisis numbers. Lenape Valley, these are all 24/7. I put Lenape Valley, I put the Suicide and Crisis Intervention Hotline, I put the National Suicide, that's the same one, Prevention Hotline, Crisis Text Line. Text HOME to 741-741, and you can text us a mental health professional. It's an ORG, so it's an organization, not a .com. All right, some practical ways on how to reduce anxiety, just in the moment. ABCDE, attention. When you feel distressed, stop what you're doing and pay attention to your inner dialogue. What's your mind telling you? This is all going to be about thoughts. Do not automatically believe your thoughts. Every thought we have is not true. Diffuse the anxiety by widening the focus. What's the bigger picture? Is this thought fact or opinion? What might you think if you were feeling calmer? Acknowledge that anxiety has been controlling your thinking and try to let the unhelpful thoughts go. It takes a little bit, it takes some practice. I'm not gonna, it is true. But again, not brain surgery. Explore options. What would be helpful to focus on right now? What options do I have available? Another one is think. Is this thought 100% true? If not, what are the facts and what is opinion? When I work with my little kiddos in therapy, I ask, and we're working on challenging their thoughts. I ask them to play detective. Let's look for clues. how do we know that thought is true or not true? Is it helpful if I pay attention to this thought? Is it inspiring, or does it have the opposite effect? Is it necessary? Is it important for me to focus on this thought? Do I have to act on every thought I have? No. Is it kind? If not, what would be a kinder thought? And that specifically surrounds ourselves. Is this thought kind about me? The thought I'm having about me? If not, what's up with that? All right, self-care. So you may or may not have heard of the term self-care. Some think of it as sitting for 3 hours and I don't ask folks to do that. I don't have time to do that. You can see on the slide I've got brain breaks and fidgets up there. Before we define and talk about self-care, I'd like to take a brain break. Brain breaks are a quick and effective way of changing or focusing right in the middle, in the moment, physical and mental state, right in the moment. Okay, just takes you away for a moment, and then you can get back to whatever it is. So a brain break is simply tap, snap, clap. Tap is tap your chest. Snap is snap your fingers. Clap is clap your hands. I'm going to do it. I can't see everybody, but I'm going to do it, and you're going to do it after me. Now I'm going to mix it up and go a little faster. So brain break time on 3. 1, 2, 3. You do after. I'm going to do 3, and then you do. I'll do the sequence, and then you do the sequence. Tap, snap, clap. Tap, snap, snap, clap. Tap, 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 snap, clap, clap, clap. Tap, tap, snap, snap, clap. Yep, you didn't, yep. So you get the idea. Fidgets, on the other hand, are.
Anybody who's depressed, they ought to be beat up.
Are you still tapping, snapping, and clapping? You are. It's okay. This is not class. This is not a test. You know, it's not. There's no final. So fidgets, like fidget spinners, remember when they were super popular, and all the kids had them, and the teachers were like, oh, we can't have them. And well, they look like toys, but they're actually serious tools for adults too. They help us increase our focus and attention while reducing stress. This one I just keep down here when I'm talking, and it does help me focus in and listen, you know, and not that because I do it for a living, so I always focus and listen. It's just, it keeps me, you know, kind of more centered. Again, though, my kiddos, the kids just can pick it right up. They're like, what do you have there? Oh, because it's so colorful. I've got a couple of them. I've got eagles somewhere. I put them in a timeout based on last season's performance. So this is what it is. All right. Self-care defined. The WHO, or World Health Organization, defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. This is a holistic approach. That means paying attention to the whole person. It doesn't mean that we have to go off into the fields for 3 days and do It doesn't mean that we have to do every single thing on this, because that's going to be stressful, right? And we're trying to avoid that. But it's broken down into categories. It's a mental health self-care wheel I put up here. And I encourage people to create their own. And I have blank wheels I give people and say, what is it you like? Crochet? Write it down, you know, whatever it looks like. So we'll start with the physical. Back to basics. Regular medical care. Get some blood work. Get a physical. You deserve it. Eat healthy. That's tricky. I agree. I remember the social meme that said in the beginning of the you know, shelter in place situation, where somebody opened the refrigerator and there was a sign in there that said, "You're not hungry, you're just bored. Shut the you know what up." No, shut the you know what door. And I was like, oh boy. So anyway, Regular sleep, exercise, get a massage if that's helpful, if you can in COVID, not necessarily always, but the times are coming back, I hope. Enjoy physical intimacy like hugs and holding hands. Again, in the future, we're getting back. Psychological, take time for self-reflection. Therapy or counseling, meditation, keep a journal, be creative, join a support group. Doesn't have to be a psych support group. They have support groups for like everything, crochet, book club, cake, people who make cakes. You know, there's support groups out there for everything these days. Emotional, explore a hobby, cuddle with your pet, community engagement, practice self-love, cry, laugh, let the feelings out. That's could be under psychological too. Spiritual, practice forgiveness, spend time in nature, connect with a spiritual community, sing or dance, yoga. I've recently tried Tai Chi, and that is awesome. Volunteer for a cause. Personal, plan and set goals, spend time with family, learn a new skill, read a book, make time for friends, reflect on who you are and what makes you special. Does this, oh, some of this sound kind of cheesy? Yeah. Is that okay? Professional, take your full lunch break, leave work at work. That's hard because I'm working from home. When I leave work at work, I'm at home, and it's kind of like, well, I don't know, see, how am I gonna? So I started just shutting the door when I leave at the end of the day. Of course, I still have my work email on my phone, and I'm going to take a look at it because that's, you know, we're human. But we're trying. Learn to say no. You know, they say if you want something done, ask a busy person. It's okay to say, I can't. Nope, not right now. Somebody else can step up. Use your vacation time and set boundaries. Here's some coping strategies to use just in the moment, every day. Escape, get away from it all, physically or mentally. Rest, have no goal or timeline for doing things you find relaxing. I recently started watching all of the Marvel movies in order of release date because I actually did some research and found and read that that's the better way to watch them. And I think I watched 13. And I had no idea I was going to enjoy them so much. And I sit there for like 2 hours and just watch. I don't pick up my phone. You know, it's forced rest. And I enjoy it. Play, again, enjoyment. Engage in activities that make you laugh or lighten your spirits. All right. You've probably heard about breathing. It kind of goes along with deep breathing is one of the best ways to lower stress in the body. It's because when you breathe deeply, it sends a message to your brain to calm down and relax. The brain then sends this message to your body and it relaxes. Breathing exercises are a good way to relax, reduce tension, and reduce stress. So I love deep breathing. It's free. It's portable. We carry it with us wherever we go. And it's super effective. Now, there are many types of breathing, like square breathing, pursed lip breathing, alternate nostril breathing. I find when starting with folks and helping them learn how to do deep breathing, it's just 1, 2, 3. And we're going to do it now. Yep, we're doing another one. It's breathe in slowly, gently, deeply through your nose, pause, and slowly, gently, deeply out through your mouth. And then we'll do it 3 times, okay? And it's just about thinking about breathing in the calm and the peace and letting out the stress and anxiety. Okay, so when I hit 3, we'll breathe in deeply through our nose, pause, and let it slowly out through our mouth. 1, 2, 3. Through the nose and pause and gently blow it out through your mouth. And again, gently in through your nose and pause and let it out through your mouth slowly and gently. Let the calm in, stress out. Again, in through your nose and pause and gently let it out through your mouth. One thing, if you want to put your hand on your chest and another hand on your belly when you're breathing, if your chest is rising up and down, that's shallow breathing, and your breath isn't getting through your whole body. Another thing I liken this to is the shower metaphor. You're standing in the shower and the water's coming down and the water's bringing out calm and peace. And the water that's going out down the drain is stress and anxiety. So you feel clean in several different levels. All right, I've put up here 5 free mindfulness apps. Mindfulness and mindfulness meditation are outstanding ways to help with anxiety and depression. I can't tell you how much research has been done on the effectiveness of specifically mindfulness on anxiety. And mindfulness is nothing more than just being and staying in the present moment. It means like thoughts come into our heads. We can't stop them. But when a thought comes into our head, we can practice acknowledging it, saying, okay, I see you. All right. I'm not going to judge you. Nope. And I'm going to let it pass. Takes practice. It's not brain surgery. Interestingly, I use a lot of cognitive behavioral therapy, or CBT, which involves learning that all thoughts are not true. Not all thoughts are true, rather. We can challenge our thoughts and even reframe them into more positive ones. So the two go really well in treatment. Simple ways to be more mindful. Senses. When you're eating, notice the color, texture, and taste of the food. You don't have to fill your time up with everything. It's okay to just be for a little bit. I have my coffee in the morning and just sit for a few minutes before the whole hour and just be. Recognize that thoughts are simply thoughts. You don't need to believe them or react to them. Try to listen without judging. Spend some time in nature. I'm not a tree hugger, but I do acknowledge the trees when I take my walk. Okay, let's see. Oh, I have here coronavirus anxiety. I think I missed one. Bear with me 1 second. Here we go. 5 free mindfulness apps. You can take a look at. I'll share it with Andrea. You can plug in. Well, first of all, some of them want you to think you have to pay. You don't have to pay. You can figure it out. And some of them you can plug in 2-minute mindfulness on whatever. 15-minute on sleep. You can control how much time you spend. Again, not 3 hours of just to give it a try. Okay, my apologies. Coronavirus anxiety workbook. I found this, a tool to help you build resilience during difficult times. It's uncopyrighted. I'm allowed to share it, as it says up here. It's from the Wellness Society. It's got a bit more detail on what anxiety is, tools to help deal with things, some more about control, practical wisdom about tolerating uncertainty, which is our world is full of, pandemic or not, how to challenge thoughts to reduce anxiety, a lot of good distraction activities, and you can even create an action plan to help you build up resilience to stress, and some further free resources. So I share that with you. All right, so I am just about done. These are resources for further information. The Centers for Disease Control, National Alliance on Mental Illness, and of course, Lenape Valley Foundation. And that takes me to, I think, my time.